The coronavirus or COVID-19 pandemic is changing all of our lives in ways that we never thought possible. This is especially true for people with pre-existing respiratory conditions who are at increased risk for severe infections. If you have a pulmonary condition or breathing issue, you must take clear steps to prepare for changes in how you access medical care. Here are the following steps. Step 1. Keep a 90-day supply of medications. Step 2. Plan for supply shortages. Step 3. Prepare your questions. Step 4. Telemedicine. Step 5. Measure your heart rate and respiratory rate. For step 1. Keep a 90-day supply of medications. Be sure you have enough of your long-term medications on hand. Talk with your insurance plan to see if a 90-day prescription can be filled so that you'll have enough extra stock at home in case there becomes a short supply. For step 2, plan for supply shortages. If you rely on medical equipment with disposable parts, like plastic suction tubing and catheters or oxygen via nasal cannula, these items may be harder to procure than usual. Talk with your home care company about getting 2 months of disposable pieces instead of the usual 1-month supply. Many companies are now allowing this. In an emergency, you may be asked to reuse and clean equipment that is typically disposable. For more information on how to clean disposable equipment in an emergency, please visit the Chest Foundation website for additional instructional videos. For step 3, prepare your questions. Your established doctor is still there for you, but their staff may be very busy and may delay in returning telephone messages. Some of their staff may also be working from home. It is a good idea to write down your specific questions before you call. Be as exact as possible. Try to prioritize the issues that are most important first. For a list of questions to ask your doctor regarding your interstitial lung disease, explore the Chest Foundation's Living Well with Pulmonary Fibrosis guide linked below. For step 4, telemedicine. Your doctor may have a telemedicine option. This allows a video meeting instead of traveling to a doctor's office. Charges may apply. Consider contacting your doctor's office to see if this is right for you. For step 5, measure your heart rate and respiratory rate. Measure your heart rate and respiratory rate now while you are healthy so that you know what is abnormal if you were to become sick. A pulse oximeter can be used to give you a heart rate. Either a battery-operated pulse oximeter purchased at a local pharmacy or an app downloaded to your phone will give you a reliable reading. Always be sure that your hands are warm when using an oximeter. To measure your respiratory rate, use a watch with a second hand or a phone's timer function. Set it to a minute and watch yourself in the mirror breathing. You may need to do this a few times to get an accurate respiratory rate. Please check in regularly at chestfoundation.org for resources that will be frequently updated. We are champions of lung health, and we will help you get through this together.